When most people are diagnosed with breast cancer, they have no idea of what all the terms mean. ER positive, HER2 positive, triple negative, stage this, grade that. It's so much to take in, and honestly, it's overwhelming. And for the most part, everyone is just scared. So if you want to know more about how to read what it is that you're looking at when you look up your results, when you're looking at my chart, then this video is for you. Hi everyone, welcome back to my channel. If you're new here, I'm Zacobia and I wear many hats and many titles, but what probably brought you to my channel and this video right now is the simple fact that I am a breast cancer survivor and I like to talk about most things that people don't talk about. So in today's video, we're going to walk through what your diagnosis is actually saying. And this will be part one of a series from diagnosis to decision, where we'll cover a lot of the steps in between. So be sure to turn on your notification and subscribe to the channel if you want the full breakdown of what to expect next. All right, so let's dive in. Okay, there are three main types of breast cancer. There are many subtypes, but to keep things simple, just know that most breast cancers are going to fall into one of these three categories, and that is they're either going to be hormone receptor positive or negative, they're going to be HER2 positive or negative, or they're going to be triple negative. So your hormone receptor positive breast cancers are going to be either ER positive or negative or PR positive or negative. And these are breast cancers that grow in response to either progesterone or estrogen. And so that's where the ER and PR comes from. They tend to be slower growing and they tend to respond much better to hormone therapy. And so if you have a receptor that is positive for ER, estrogen, PR, progesterone, it is more than likely going to be able to respond to some type of hormone specific targeted treatment. Okay, the next category is going to be that HER2 category, and it's going to be either HER2 positive or HER2 negative. HER2 is a protein that unfortunately makes cancer cells grow faster. And these particular subtypes of breast cancer used to be a problem because they tend to be more aggressive. But with new treatments, we have targeted treatment now for HER2 positive type cancers. And so there is a treatment called Herceptin that is a specific targeted treatment for that HER2 protein. And so they don't tend to be that much of a problem as it used to be because of that now. The next category is going to be that triple negative category. Triple negative breast cancer is basically a subtype of breast cancer that is negative for all of the things that I just mentioned. And so it does not have positive estrogen receptors. It does not have positive progesterone receptors, and it does not have that HER2 positive protein. And so when all three of those things come back negative, then it is termed triple negative breast cancer. Because it doesn't have any of those markers, they also tend to be more aggressive, and it tends to affect more younger women and Black women. This is the subtype of breast cancer that I was diagnosed with. But the fortunate thing is that breast cancer treatment for triple negative breast cancer has also come a long way. Now there is immunotherapy and there is carboplatin, which is a type of chemotherapy, adriamycin, which is another type of chemotherapy that they have realized when they combine these treatments together in this therapeutic range, that it is more likely to be able to treat the triple negative breast cancer cells. And so thankfully, because of that, I can be here today as a survivor and a witness to be able to testify in terms of what it has done for me. Okay, so when you look at your breast cancer report, if you're one of those people that, you have some type of electronic medical system where you can get results before doctors, nurses even call you, then you have access to be able to look at this stuff beforehand. And when you look at it, if you don't have an understanding of what you're looking at, you are going to be, clueless, and you're going to be extremely afraid and go to Google, which isn't good. And I've talked about that before. But this is what you're going to see on that report. If you do look at it, you're going to see whether or not it falls into one of those categories, if they've already done that part. It tends to be a two-step process in terms of how these results are populated. And so if you are the person that discovered, a lump or a mass, Or if you had a mammogram done and it discovered something that was abnormal, then they're going to refer you to a biopsy. When you have that biopsy done, the biopsy is going to result in two parts. And so the first part is usually going to tell you whether or not those cells are cancer cells or they're normal breast tissue cells. From there, that sample is also going to be sent for further testing to see if it has any of these markers. And so if it's identified that it is cancer cells, then they want to break it down even further and look at the cancer cells and determine whether or not they have any of these markers that I just explained. They're looking for whether or not it is a hormone receptor positive breast cancer. They're going to look and see if it is a HER2 protein positive type cancer, or whether or not it doesn't have any of those receptors that we just talked about. And so that's where the report really gets into detail in terms of explaining what it is that you have felt or what it is that that mammogram has found. From there, your diagnosis and report goes into a staging process. Doctors are going to want to know, has this cancer cell spread outside of the breast? And so the staging system ranges from 0 to 4, with some of the numbers in between having an A, B, or C category with it as well. And I'll break that down a little further. And so stage 0 basically means that it is in the duct or the lobule, and it has not left that area at all. And so it's really like centralized, and it's really in a controlled area that, it hasn't spread beyond that particular area of where it started. Most time you see this as DCIS on your report. Stage 1 tends to be a smaller tumor that may have left that duct or that lobule area, but it's still really small and it's still really like contained, and it hasn't spread to any lymph node or anything like that. And so if you see that stage 1, that's basically what it's telling you at that point. From there, you'll go to stage 2, which means that the tumor may be a little bit larger at this point, or it could be that it has maybe touched a lymph node. And so that's where you'll get the stage 2 diagnosis from. From there, we have stage 3. Stage 3 is usually definitely some type of lymph node involvement of like a multiple number, like maybe more than one lymph node. And from there, they're going to do additional testing to see, how much further it possibly could have spread. And then that last stage is that stage 4. This is where it's usually considered like metastatic. When you hear that terminology, metastatic means that it has left the breast area completely and has gone to another area of your body. There are multiple areas that it could spread to. And typically at that point, they're doing PET scans, more additional scans to see where that tissue has now, spread to. And it's spreading via the lymph node system. That is the vehicle that is taking those microscopic breast cells to another region of your body. And so when you get a staging from your doctor, it's typically going to come with like a TNM, a letter behind it, or they refer to it as the TNM system. And so T meaning that tumor, N meaning whether or not it was any lymph nodes involved, and M meaning whether or not it has metastasized to another part of the body. I have heard some women at that stage 3 mark say the words metastasize, but to be honest, most doctors refer to metastases when it has reached somewhere else outside of the breast area, another completely different region of the body. Usually with stage 3, if it has just gone to the lymph nodes, they may loosely use that word metastasize to the lymph nodes, but it's not the same as when you're referring to someone that is stage 4 and it has metastasized to a lung or metastasized to a liver. Again, another completely separate region from the body. And so again, your staging is going to be based off a series of that combination of that TNM system, where it's letting them know basically what will be the best treatment path for that individual. And then going back to how I was saying earlier with the staging, because Sometimes you can have a 1A or 1B. Anytime it's not quite like 100% clear if the tumor has like gone outside of that breast tissue, they may put a 1B with it or 1C with it, depending on that tumor size and whether or not it, has done something a little bit different. And so not everything is just completely like, textbook, so to speak. I shouldn't say textbook. Not everything is completely just a 1, 2, 3 system. Some things will come with a subcategory up under it as well. The main thing in all of this in terms of staging is for you not to panic. Regardless of what your doctor says your staging is, that doesn't necessarily determine your outcome. And I say that because there has been so many advancements in treatment options for all different types of breast cancer. And so because of all these advancements in therapy and treatment and all of that, now a staging can't really determine the outcome for an individual, because we have women that are stage 4 who are also living a long life because of all these advancements in treatment options that are out there. And so the other part to that is even if it is a stage 0, don't get completely like complacent in the fact that, wow, thank God it's just stage 0, because there are women who go from a very low stage to a stage 4 in a matter of months, just because of the type of, tissue that they were dealing with, the type of cells that they were dealing with. And depending on the cells and the characteristics and what it tends to do, there are some subtypes of breast cancer that even if they were found early, they can do something different in just a matter of months. And so again, don't panic, but don't get too comfortable either. Always be aware and alert of, your diagnosis and what you're going through and what your particular subtype, has characteristics of doing. Get very familiar with your diagnosis and your subtype of breast cancer. The next thing that you'll see on your report is probably the terminology of like grading system or grade. And so there is a grading system that pathology looks at as well. And this is specifically talking about like characteristics of the actual cells that were present. And so if you see something that says, and it usually ranges from grade 1 to grade 3. Grade 1 usually means that those cells is really hard to even determine that they're abnormal because they're very closely, they look very close to normal tissue cells. These tend to be very slow growing cells because they, look very close to normal tissue cells. And so a grade 1 tends to be, maybe less of a panic when you're looking at that report from the medical standpoint of things. Next, you'll have the grade 2, which, as you can imagine, with it being in between 1 and 3, it's more of a median or intermediate level. And so there are going to be some changes in the cells that are going to be more present. You see more changes present in that grade 2 than you see in a grade 1. But it's still very, intermediate is very moderate. It's not a lot of it. With the grade 3, that's where you see a lot. There's a lot of changes in the cells. You probably see, and when I say you, meaning the pathologist, the pathologist is probably seeing more abnormality than normal. And that tends to mean that cancer may be a more faster growing type of breast cancer. And so that is going to be something that may be treated a little bit more aggressively because of that grading system. The oncologists do use the TNM system and that grading system to help them determine, again, what's the best treatment or what's the best plan of treatment for this particular patient and their particular diagnosis. With all of that, they're able to determine grading based off of the breast tissue sample that they take from the biopsy or the lymph node sample. And if there are breast cancer cells present in those lymph nodes, it doesn't mean that all is lost. That kind of goes hand in hand what I was saying with staging. It doesn't mean that all is lost because, again, there are many, many, many treatment options out there. But doctors are using, again, that full system to help determine what's best for the patient. And so knowing your type, your stage, and your grade are what's going to be very beneficial in the team developing the best treatment plan for you. So not all hope is lost, regardless of where you fall on that. It just means that, again, they're using that specifically to find, the best treatment plan for you. Okay, so let's recap. So we have subtype, we have staging, and we have grade. And so subtype, again, is going to tell us whether it is ER or PR, positive, negative. It's going to tell us whether it's HER2, positive or negative, and it's going to tell us whether or not it is triple negative. Then we're going to go into the staging system. Staging, remember, that ranges from 1 all the way to 4. And then we go into the grade system that ranges from 1 to 3. Staging tells us whether or not it has left the breast duct, the breast lobules, whether or not it is more breast tissue, whether or not it is a lymph node involved, whether or not it's a whole nother organ involved. That is what the staging is going to tell us. And then the grading is going to tell us how aggressive those breast cancer cells are, whether they are slow growing and look more like normal cells, or whether they are fast growing and they completely look abnormal under the microscope. Now, there is no way that you're expected to know all of this. There's no way for you to know all of this unless you are already working in the field. If you're already working in oncology, specifically breast cancer, a breast cancer unit or field, then you may know a lot more than the average person. But for the average person, they're not going to know all of this. And that is why this video is for you. This is to help you, because the more you know, the more you educate yourself and the more you familiarize yourself with the terminology as it relates to your diagnosis, the better equipped you are to address questions and concerns and be an active member in your care team in determining what's best for you. This makes you feel more empowered. It makes you not feel, it makes you feel in more control of what's going on with you and the next steps and your future, essentially. So it's important. And that's kind of why I wanted to use this first video to just kind of start there to break it down. Because if you are newly diagnosed, this is what you're looking at. And this is what looks like foreign language to you, basically. And so that is what that means when you see something like that. Okay, so that's it for today's video. You don't want to miss the next video. I'm going to tell you that. The next video is where I'm going to cover the 5 most important questions to ask your oncologist at that first appointment. So trust me, you don't want to miss it. All right. And so be sure to subscribe, turn on that notification button, and just be involved in this process so that you can be involved in your process as it pertains to, surviving and beating a breast cancer diagnosis. So thank you so much for watching. Again, hit the subscribe button and let me know down in the comments, like, what is the biggest question you have right now? So if you are watching this and like I said, you just, found out you got a positive, result from your mammogram and your biopsy, and you are scared to death, what is the number one burning question that you have right now? I don't know that I have the answer for it, but man, if I don't have it, I'll definitely try to find it for you. So let me know down in the comments what's the number one question you have. And like I said, be sure to tune in for the next video. All right. Thanks, guys.